Assalamualaikum warahmatullahi wabarakatuh. Here I will present about the journal, and the title is Prevalence of Risk Factor for Diphtheria, CDLS and DPT Avie Syahputri Immunization Coverage in East Java, period 2018 until 2020. And this is our team, and allow me to introduce myself. My name is Avie Syahputri Hassan, with student register number is 51. The topic of this presentation is the first, introduction, the second, methods, the third, result and discussion, the fourth, conclusion, and the fifth, resource. The first is introduction. Diphtheria is one of the diseases caused by the pathogenic bacterium Corynebacterium. It previously became an old public health concern, but it is now reappearing as a re-emerging disease. This toxic strain of gram-positive Bacillus diphtheriae causes diphtheria. It gives some effects on the body. Infection of the skin is one of the symptoms caused by diphtheria. It also infects the upper respiratory tract, which can cause serious complications and even death. Corynebacterium diphtheria, which infects local body organs and produces very dangerous exotoxins, may cause heart, muscle, and nervous system disorders. This diphtheria disease is transmitted through the ears, places of saliva when talking, and direct contact with diphtheria sufferers. Besides, they generally attack the pharynx, nose, larynx, and tonsils. The appearance of a gray asymmetrical membrane surrounded by redness of the throat and enlarged lymph nodes is another symptom of diphtheria. In Indonesia, 944 cases of suspected diphtheria spread across 25 provinces in 2019, while until May 2020, 129 suspected diphtheria cases were found across 16 provinces. The low coverage of community-led total sanitation (CLTS) and DPT-Avie Syahputri immunization is one of the factors contributing to diphtheria. A bad environment with poor sanitation can lead to the presence of diphtheria germs, which are easily transmitted to other people through the air, droplets, and close contact. With DPT-Avie Syahputri immunization are useful to form strong antibody, and health interventions become effective in reducing infant and under 5 mortality because of diphtheria, as people have formed their herd immunity. The second is methods. This study is a population correlation study conducted in 38 regencies or cities in East Java as a unit of analysis. It includes the incidence of diphtheria as the determining variable and community-led total sanitation, CLDS, and DPT-Avie Syahputri immunization coverage as independent variables. The secondary data used were collected from 38 regencies or cities accessible freely in the East Java Province Health Profile Book in 2018, 2019, and 2020, which states all variables needed. Descriptive data analysis was done using a health mapping version 4.3.0.0 with product version 4.03. The data on the variable were presented in a regional redistribution map. They were tested for normality before the Kolmogorov-Smirnov test were performed. And the third is result and discussion. No correlation was found between CTLS coverage and the incidence of diphtheria in 2018, while there was a correlation between DPT-Avie Syahputri immunization coverage and the incidence of diphtheria in 2018. Distribution of diphtheria incidence and community-led total sanitation (CLTS) coverage. The incidence of diphtheria tends to decrease as CTLS coverage fluctuated every year during 2018 until 2020. The current results are different from previous studies where the Poisson regression modeling test indicate a significant value for CTLS coverage. The result of Poisson regression modeling indicate that CTLS has a significant value and is at significant levels of 0.05 point. According to the regulation of Ministry of Health Republic Indonesia number 3 Menkes 2014 concerning community-based total sanitation, community-led total sanitation (CLTS) includes three strategic components. It is creating a conducive environment, increasing sanitation needs, and increasing access to sanitation. Distribution of diphtheria incidents with DPT-HP-HIV-3 immunization coverage. This incidence of diphtheria tends to decrease as DPT-HP-HIV-3 immunization coverage fluctuates every year during 2018 until 2020. Age, gender, parental education, socioeconomic status, immunization status, and close contact are considered to contribute to the incidence of bacteria. This study concludes the importance of complete basic immunization to reduce the incidence of bacteria. Due to the higher DPT-HP-HIV-3 immunization coverage, the lower the number of cases of diphtheria. According to Law Number 36/2009 concerning health, immunization is demonstrable to suppress and reduce mortality because of infectious disease in children. Immunization status had the most significant value associated with the incidence of diphtheria. One's immune system may increase through immunization. Immunization is considered to prevent disease transmission through air or contaminated food. The fourth is conclusion. A significant relationship existed between the incidence of diphtheria cases and DPT-HP-HIV-3 immunization coverage in East Java Province 2018 until 2020. However, community-led total sanitation (CLTS) coverage didn't give any significant relationship with the incidence of diphtheria within the period. The incidence of diphtheria tends to occur in areas with low immunization coverage every consecutive year. Few areas or villages 13% with low coverage of community-led total sanitation (CLTS) face shrinking diphtheria cases. Education for public about the importance of DPT-HP-HIV-3 immunization is required, and maintaining a clean environment is another important effort to prevent diphtheria transmission. The fifth is resource. The source used is the Environmental Health Journal from Erlangga University. Thank you for your nice attention, and sorry if I have mistakes. The last I say, wassalamualaikum warahmatullahi wabarakatuh.